as we know, not all strokes are the same. So let's tell us about some of the different types of strokes that we hear about.
Right. So the most common type of stroke, accounting for about 80% of strokes that we see, are what we call ischemic. And so an ischemic stroke is actually the artery supplying the tissue is blocked, usually from a clot. And then it causes, again, death around that artery. About 20% of the other strokes are what we call hemorrhagic. So that's a rupture of the vessel supplying that area, often caused from things like very elevated blood pressure or an aneurysm, sometimes trauma. And then even more commonly, patients hear what we call TIA. And TIA for a neurologist is fairly specific. It stands for transient ischemic attack. And these are symptoms that would account for an almost stroke, or some people call a mini stroke, or maybe a temporary reduction in the blood flow around that area, and can cause symptoms that look like a stroke that are often resolved and leave no residual or permanent damage to the patient.